Hi, my name is Dr. Kat Kesty, and I'm a double board certified dermatologist at St. Petersburg Skin and Laser in St. Petersburg, Florida.
And I'm Dr. Kesty's sister, also Dr. Chelsea Kesty, and welcome back to our show.
And today I'm super excited because I'm going to be asking Dr. Kesty about a procedure that she's one of only a few people in the United States that do. So let's just get right into it. First of all, what is a blepharoplasty and what is a laser blepharoplasty?
It's a good question. It's also a mouthful, and most of my patients don't say it right. So something about upper eyelid surgery, and we'll get the point across. So that's what it really is taking the hooded eye on both eyes, basically getting that upper eyelid excess skin and taking that out. And usually the difference between a laser blepharoplasty versus a normal blepharoplasty would be how you do the incision or how you do the surgery. So how I'm doing it is using an incisional CO2 that's 0.2 millimeters in width. So that's a teeny tiny amount. And basically that makes the field and surgery really clean cut and also the recovery a lot faster. And there's a lot of benefits, but that's the main difference.
So what you're saying is that a blepharoplasty is where you remove some of the upper eyelid skin, but instead of using a knife, you're using an ultra precise laser.
Exactly.
I sometimes go on Instagram and I'm seeing so many celebrities, so many influencers that are talking about their blepharoplasty. Is that the same thing as what you're talking about?
Yes, I mean, essentially, yes, because basically what we're going to do is take that excess skin that you have on the upper eyelid, recreate that upper eyelid crease, and make you look very, very young.
That sounds great. Where can I sign up?
I mean, the other major difference between using a scalpel and then using a laser. So what can I do that's with a laser technology that surgeons with just a scalpel can't do? And that's something actually and this is a little bit gory. So if you don't like gory details, skip forward for the next kind of 45 seconds. When I actually take that excess skin off, then we're kind of left with almost like a fascia, but it's basically part of the orbit and basically part of the kind of eye anatomy is showing. And actually I use that laser, the same laser, to tighten in that area underneath the skin. So in normal laser procedures, all I can do is try and tighten from the top layer of the skin, but I have to be a lot more cautious because of the risk of scarring, hypopigmentation, and all the other things that come with laser. But once that top layer is gone, I can actually tighten a lot through there. And so that helps. And I think that one helps with the rejuvenation of that skin in through there, but also helps the tension on the sutures, meaning that the scar is going to look better. And also I think, realistically, a blepharoplasty is going to last 10 years. But I think with that extra tightening through there, it's probably going to increase the longevity of those results for the patients.
So what you're saying is that when patients get a laser blepharoplasty compared to a traditional blepharoplasty, they're getting a lot of skin tightening as well for kind of overall rejuvenation of the eye area to get you a longer result than, the traditional 10 years with the blepharoplasty.
Yeah, exactly.
Okay.
Like taking that kind of zoom out picture, I'm trying to provide my patients the best results and with the technology that I'm familiar with. I think combining both of those with the goal of having a surgical blepharoplasty, but also kind of adding some extra benefits for the patient.
And tell me about other benefits of the laser blepharoplasty versus the traditional knife blepharoplasty.
There's less risk of bruising because at the same time that I'm doing cutting, it actually has something called coagulation, so almost like cautery, but it's basically like that on the skin edges. So there's really a lot less kind of bruising in that area. There's still stitches and a scar, which is similar to a surgical blepharoplasty, but again, some of the downtime and some of the long-term consequences can be mitigated by using a laser.
So you're getting a smaller scar with a laser because it's more precise than using a knife.
Yes, I mean, you're getting a 0.2 millimeter scar. That's kind of what you're getting as far as that's how far as the incision is. So that's how big the scar is. So yeah.
That's awesome. And so you just published a paper on this in the Journal of Cosmetic Dermatology, a case series. Tell me about that paper and why you published it and what those patients had that was kind of special.
So it basically is looking at how I'm combining what we just talked about, so upper eyelid blepharoplasty using that incisional CO2. And then I'm also doing like an erbium or a different laser that is causing some tightening in and around the lower lid. So most people have a protruding fat pad or some bags under the eyes. mainly in women, but also sometimes in men. If you take that fat pad out, it tends to hollow the patient. And so I don't think that ages very well. It kind of looks more aged in my opinion. So what I'm actually trying to do with the lower eye rejuvenation is basically use a laser to target the areas and tighten and basically rein that fat pad back in and create healthier skin on top to kind of push that back down, so to make it less noticeable. So in that paper, we had a series of patients who had both the upper eyelid laser blepharoplasty plus that lower eye rejuvenation. And again, you can look at the before and afters for yourself, but they had some artificial intelligence basically do a aging scale, and most patients look about 5 to 10 years younger.
Well, that sounds great. All my patients that you've done have been super fans and loved it. I always tell them just be warned, because if it's, someone email, I'm like, you're going to look like your daughter. You're going to come back in for your follow-up with me to get your Botox or, laser or filler, and you're going to look like your daughter. And I may not recognize you out in the community. So you're going to have to just remind me that you're not your daughter. You're my patient after.
I mean, definitely the most surprising thing is that when I show people how much skin we're actually taking out, everyone is continually surprised by how much skin I actually can get out, because it's really actually, if you think about the measurement of 0.2 millimeters as far as what that scar looks like, but how much skin I'm actually taking out is usually between 12 and 17 millimeters. So that's about almost an inch. So that's a lot of skin that we're taking out of people. So it looks a lot different, and people look, like I said, much more rejuvenated.
But still very natural. Like they haven't had anything done, right? Because we're not changing their facial contours. We're not, really changing them into something that they're not. We're just making them kind of 10 to 20 years younger.
Exactly. Basically, I'm not kind of changing the eye shape at all. I'm really kind of conserving that and really just changing the amount of excess skin that's there, whether that's a lot and now it's none.
So kind of just to sum up what you're telling me, the patients in the study that you presented, which, we'll link at the bottom in our show notes, you did upper lid laser blepharoplasty, lower laser rejuvenation, 7 days downtime, and they look 10 to 20 years younger.
Yeah.
And that's what you do. That sounds great. When can I get on your schedule? So if patients that are watching wanted to make an appointment with you or interested, how do they go about finding you or learning more about this procedure?
You can read that paper that we'll link below, but also reaching out to our office or DMing us would be great.
Well, thank you so much for telling me about it.
Yeah, of course.
If you guys have any more questions for Dr. Chelsea Kesty about the laser blepharoplasty, the laser eye rejuvenation, or anything else that we talked about, please feel free to reach out to us, send us a DM, leave us a comment. And thank you so much for watching.